The Healthy Markets Community of Practice is basically a group of people who are, or a group of interested individuals, partners who want to understand a bit more about FP market development, sexual health, sexual and reproductive health market development, and private sector engagement work happening in countries, and to discuss and come together and share some learnings. It is co-chaired by USAID. That is, if I can ask all the participants to mute themselves, please. Yes, and so the community of practice is co-chaired by USAID and UNFPA, and usually USAID is represented by Andrea Bear, but I believe today she is otherwise engaged, so will not be participating. We do have Kuyosh Kadirov and other USAID team members on the call, and on the UNFPA side, it is represented by Ben Light. Important to note, this is an evolution from the Total Market Approach Technical Working Group that has been operational since 2014. Next slide, please. And as far as the team is concerned, the secretariat for this community of practice is the Frontier Health Markets Engage project, and the team members are myself, Farhan Yusuf, who is a fellow with Results for Development. We have Judy Mboya, our other colleague who is also not present today, and in the background we have Elizabeth, who is one of our key team members handling especially all the administrative work. For those of you who have joined us previously for these Healthy Markets community of practice sessions, I think one thing that is slightly, maybe I would say, unique about this particular session is that we are now moving into a phase where we want to collaborate more and more with different partners, with different individuals, to organize these sessions in different countries. And so for this particular session, we have worked very closely with Zenysis, and they actually are one of the presenters. So we'll find out a bit more about the work that they are doing in Zambia, but a big shout out and thank you to Zenysis for helping with organizing this particular session. I won't, talk much about the background. The information is available on the slides. Some few reminders to participants. Please feel free to introduce yourself in the chat. Provide us your name, your organization. Please stay muted for the presentation until we come to the discussion time. At any point of time, however, feel free to use the chat to share your ideas, your thoughts, any questions that you have, and we'll get to all those in the discussion period. This session is going to be recorded, and we will be sharing a recording later. Now, usually we have an opening remark from one of our, co-chairs for this particular session. It was supposed to be Ben from UNFPA, but I know he had an urgent commitment, so I'm not sure if he has joined or not. I don't see him having joined, so maybe Kuyosh, do you want to maybe come off mute and just say hey to everyone and just not provide opening remarks, but just say hey to everyone as one of the co-chairs?
Absolutely. Thank you for that, Farhan. And we're looking forward to exciting presentations from so many partners doing fantastic work in Zambia. And we also have a pleasure of our Zambian mission colleagues to also participate. And so great to see so many names joining today, and we can start and start exploring the learnings from the Zambia, and I look forward to everyone's questions and contributions in the chat, but also feel free to come off mute, and let's make this session as useful for everyone as possible. Farhan, thank you.
Thank you so much, Kuyosh. Elizabeth, if you can go to the next slide, please. Yes, so this is our agenda for today, and we have some very interesting presentations, a wide variety of different stakeholders doing, some very interesting pieces of work in Zambia, from private sector engagement to data related issues to service delivery elements to availability of products. So we'll hear a lot, a bit of all of that in the discussion today. So I think we can jump right in. And, to start it off today, we have Dr. Lucy Nyundo from the ZamHealth team who will start us off with the first presentation. Welcome, Dr. Lucy. I know you've already joined.
Thank you. Hi, everyone. Can you get me? Hello?
Yes, Dr. Lucy, we can hear you.
Okay, thank you. I'm going to make this presentation on behalf of the USAID Zambia Accessible Markets for Health project. And I'll just give sort of an overview of the family planning and sexual reproductive health market in Zambia. And then towards the end of the presentation, I will share what we are doing as a project in terms of this particular market. Next. So the USAID Zambia Accessible Markets for Health project was started its implementation in 2021 and it goes on until 2026. It is funded by John Snow Health. It is funded by USAID, but implemented by John Snow Health Zambia Limited with other partners, JSI, Pharmaxis, Mopani. In terms of geographical focus area, we are working in 4 out of the 10 provinces of Zambia. And so far, we have onboarded 232 clinics, hospitals, and pharmacies, all in the private sector. Next. In terms of the project goal, objective, and approach, the goal of the project is really to improve the capacity of the private sector to sustainably deliver high quality products, services, and information. And the project is really run on a TMA framework or approach. That is what guides the entire project. And it has 4 objectives. One of the objectives really focuses on demand generation. 2 of the other objectives, that's objective 2 and 3, focus on expanding availability and accessibility of 1, the products, and 2, the services. And the 4th objective is really to strengthen the enabling environment for private health sector. So those are the 4 objectives, and we focus on total market approach. Next. So as indicated, we would like to have a high level of appreciation of family planning market in Zambia. And so in terms of population, we are over 19 million people in Zambia. The gross domestic product is at 5.2%. The modern contraceptive prevalence rate among married women is at 47.8%. That is according to the Zambia Demographic and Health Survey 2018. But I'm sure you know that we always also track latest information. So the latest information is showing that that rate is now sitting at about 52% among married women. In terms of total fertility rates, we are at 4.7 births per woman. And in terms of health infrastructure, like other countries in the region, we have both public and private sector, which are segmented as MOH, Ministry of Health owned, some are faith-based owned. We have a small percentage that is owned by the defense, but that would still be considered as public sector and private sector. So from the mix of ownership categories for the facilities in Zambia, you see that the public sector still has a huge component. Most of the funding comes from both the government, the local government, and the cooperating partners such as USAID and DFID. Zambia recently, not long ago, a few years ago, rolled out the National Health Insurance Scheme, commonly referred to as NEMA, which also covers family planning services and products. However, I think we need to work collaboratively, that's public and private sector and other stakeholders, to make the scheme sustainable. Next. Of interest, obviously, is our understanding of the method mix in Zambia. And in terms of the method mix, we have several products on the market, be it public or private sector. However, you see that majority in terms of preference or usage or uptake is really around the injectables. But we also have implants, condoms, and other methods. We did a landscape assessment as a project, and we established, as of 2022, there were 8 suppliers of condoms, 4 suppliers of oral contraceptives, and 3 suppliers of injectables on the Zambian market. And all these import from different countries: USA, China, India, Germany, and the UK. There is no local manufacturer. Next. In terms of source of methods and volume, from the statistics, you see that most of the people in Zambia currently access these products through the public sector. And that also presents an opportunity, despite the barriers that may be there in terms of the private sector. But clearly, there's opportunity for us to shift or at least alter this distribution of source of modern contraceptives in Zambia. And the market in terms of the volume seems to be growing over time. As of 2021, for example, the implants was sitting at 239,000, injectables over 3 million.
See you, have a good day.
Way higher than the other methods. Sorry, there was just some feedback from the background. Next, please. In terms of registered private sector entities, with respect to the market, I think it's important for us to appreciate that we have over 1,000 retail pharmacies that are registered, and private health hospitals and clinics are over 800. These basically present opportunities or access points through the private sector. However, it is not all of them that have the capacity to be able to deliver family planning products and services, but this just gives us an idea of what is there in the market. And obviously, we are working with a number of retail pharmacies and private hospitals and clinics. But from what I had earlier indicated, you will see that it's a small percentage compared to what is sitting on the ZAMRA and HPCZ register. But that presents great opportunity for us to expand the market. Next. So obviously, as a project, we work to increase private sector participation in the FP-SRH market. And at the onset of the project, we did carry out landscape assessments, and we also are engaged in co-design workshops with private sector. And that is the results and the meetings really informed our interventions from the onset, and the interventions that we're still implementing now. For example, in terms of market intelligence and data gaps that we identified, we are working with private facilities to make sure that they're onboarded. We train them and make sure that they're onboarded onto the national HMIS2 system, and for them to be able to report onto the platform. We are also heavily investing now in undertaking market studies for us to have current and consistent data around the market. We also identified and noticed market inefficiencies. Part of that is as a result of free family planning products that are distributed in and not in a well-coordinated manner. And so we are working with both the public and the private sector to have a better targeting of the different segments of the population. So what we are trying to do is we obviously work with private facilities that we have onboarded to build their capacity for them to be able then to deliver these services. We also recognize that a lot of these products, for example, the DMPSC, is accessed from the Ministry of Health. So we are building the capacity of private sector to be able to access that, but also account and track that, that stock. We recognize that that is not sustainable when we are talking about developing a healthy market. And so we are exploring food procurement among private facilities for them to be able to sort of pull their resources together and buy stock through the private sector channel and be able to service the market in that sense. Lastly, but not the least, next slide, we also recognize the regulatory and policy issues that can be quite complex, and to address that, we facilitate public-private sector dialogue by offering technical support to the Healthcare Federation of Zambia, which is at high level. But we also recognize that these engagements are also important at district and provincial level. And so we facilitate the formation of district level private sector associations, which feeds into the Healthcare Federation of Zambia. Overall, now and going forward, the Ministry of Health remains an important stakeholder in developing this market. And so we recognize that we need to support the Ministry of Health by building their stewardship capacity of developing a healthy market. And we also ensure that private sector submissions are made or taken into consideration in the policy development process. So basically, that's how we feed into the private health market, but we also closely work with the public sector. Thank you.
Thank you so much, Dr. Lucy, for starting us off with this discussion today. A great overview of what the market looks like in Zambia, and we look forward to hearing more from some of the other speakers as well. Next up, we have Sitabiso Moyo from Planned Parenthood of Zambia. Sitabiso, I see you have joined, please.
Good afternoon, everyone. So basically, I have, I think, what is the shortest presentation. Basically, the Planned Parenthood Association of Zambia, PPAZ, is a non-governmental organization that works to complement government efforts operating within the borders of Zambia. Our vision as PPAZ, is to have a society in which all Zambian people enjoy equal sexual and reproductive health services and rights, and have access to quality and affordable sexual and reproductive health information and services. So all the work that we do, including working with the public and private facilities in the provision of sexual and reproductive health services, is towards attaining this particular vision. We can move to the next slide. Yeah, so as PPAZ, we work with various stakeholders who we service as part of our target in achieving our vision. But at the center of the work that PPAZ does is the clients, because for our clients, we strive to provide the best services, and every work that we do is in their best interest. But of course, we cannot operate and work in a silo. So PPAZ works, with government and public structures, such as the Ministry of Health, the Ministry of Education, Ministry of Finance, and National Planning. As well, we also have our international partner, which is the International Planned Parenthood Federation, IPPF, that provides, technical assistance, as well as, technical support in order for us to achieve some of our mission and our goals. Then we also cannot operate and work without our cooperating partners and donors. And we have worked and are working with donors such as UNFPA, UNESCO, the Global Affairs Canada GAC, the Global Fund, GIZ, as well as the Japanese Foreign Affairs, and also various other civil society organizations that we have partnered with to ensure that service delivery is taken to the best highest standard, but also to legitimate some of the interest in the future direction of sexual and reproductive health services. It is also important to note, like I said, our clients are at the center or at the heart of what our PPZ work is. So currently our target population of the people that we serve, we reach out to, from our numbers, we hear 89% of the people that we serve are women, 38% are youths, but of all these, the clients that we serve, 83% of them are persons living in humanitarian situations, vulnerable populations, etc., etc. We can move to the next slide. Yeah, so in order for us to reach out to these to our clients, we do have various service delivery models. We have our static clinics based in Lusaka, Livingstone, Choma, and Kitwe that provide services directly to clients, but also use other channels to reach to reach our clients. So we use the model of community-based distributors who are based in various communities, who replenish with short-term family planning, and also they're able to provide family planning counseling as well as HIV testing within the communities. We also conduct mobile outreach services to, far-flung poverty-hit communities that are in need of our services, and in instances of humanitarian situations, using our mobile outreach, we provide services in humanitarian services. But we also work within associated health facilities to try and work within the government. I mean, government is the biggest provider of health services in the country. So to enhance our service delivery, we work with the associated health facilities, which are mainly government or public health facilities. So our service delivery model, in order for it to work effectively, we use three operational models, which is number one, the social franchising model that offers capacity building to associated health facilities, training and mentorship, but also acts as a platform for ongoing quality improvement. We have a cluster model that works more at a lower level to provide coordination, local level advocacy, data management, and quality assurance for the services that we provide. And then to ensure that our programs are reaching the best and the targeted beneficiaries, we conduct what we call a micro-planning model, which we use to do programmatic and hotspot mapping to see where is it that our clients needs the services the most. But we also do risk assessment to determine which of our clients are at the highest risk if we don't provide them with the service. But we also classify our clients in using that particular risk assessment, looking at the poverty heat maps, where are the most vulnerable populations and issues like that. But also to ensure continuity of service, our micro planning also helps to do tracking and linkage.
So I don't know whether it is just me, but we seem to have, okay, sorry.
Hello, can you hear me?
Yes, I had lost your sound for a bit. I don't know whether it was just me, but please go on. Apologies for that.
It should have been the network. Yeah, so our micro planning also helps us to do periodic assessment to look at how best our programs are working and how good our interventions are effective on the ground, and to see what type of improvements we need to make on our interventions so that we're able to meet people in real time with their real-time challenges. We can move to the next slide. Yeah, so in terms of services that we provide services using what we're calling IPES, which is our service delivery model, that which is our integrated service delivery model that ensures that when a client comes to our health facility, our facility should be able to provide services for gender-based violence, counseling, contraception, safe abortion, STIs, HIV, gynecological, and obstetric services. So we reach our clients with this wide array of services and ensuring that when a client comes to our service, to our health facilities, or any facility that we are supporting, they are able to, get the most services from one particular visit. So in order for us to provide these particular services, we use tools such as a differentiated service delivery, where we provide services in unorthodox locations, so to say, in places where the clients need the services. One of which we are working on is a private-public partnership with private pharmacies, where clients are able to walk into a pharmacy and are able to be provided with short-term family planning. But we also ventured into self-care options of service delivery, where the client is, assisted through digital means or virtual means on, health services, counseling and consultation and things like that. But also issues of, some commodities like cyanopress, where the client is also able to administer that on their own after undergoing training. We also have digital services that we use to reach to clients where we are not able to reach them physically, to ensure that these clients are able to get the best quality of service. But our digital services also extend towards issues of mentorship and also issues of mentorship, but also issues of quality as well, because we're able to meet with wide range of our service providers using our digital platforms, but also able to view the quality of services that they're able to provide, and also if these services are being provided in an integrated manner. We have youth dedicated services. As PPAZ, we're a youth-focused organization, and all our efforts aim to provide, and most of our efforts rather, aim to provide the best services for the young people out there. We provide in our health facilities laboratory and imaging services for ultrasound and laboratory services for STIs and any other investigations that may be needed. But then again, how will people access services without awareness? So we do provide health awareness for our clients and people in the community, especially those in colleges and universities, on the availability of services that they can come and access at our facilities, as well as the public health facilities that we are working with. We also provide escorted referrals through our peer educators and peer mentors and peer navigators from their communities to the health facilities to ensure that our clients reach, the service delivery point. The essence of having the escorted referrals is not to coerce someone to have, to go and collect a service, but to just build that, confidence in the client, and also, just give them a level of assistance so that they're able to go to the health facility and feel comfortable as they go to access the particular service. I did mention IPES. I just realized that I just said IPES without saying what it means, but IPES means Integrated Package of Essential Services. So these essential services are 8 services altogether. And like I said, the way the IPES works is to ensure that when a client comes to the health facility, they are met and provided with the most services that they can get at that one particular time. Yeah. I think I've got one more slide. That says thank you. Yes.
Thank you so much, Sitabiso.
Right.
Yeah. Well, it was not as yes, it was not as short as you thought it would be, but we could see that you are enjoying sharing all the work that you do, which is great work, and we can discuss on that later in the discussion time. Reminder to all the participants, please feel free to put in any of your thoughts, questions, etc. In the chat. Next up, we have Likando Songolo from the Mary Stopes team in Zambia.
Hello.
Yes, welcome,
Hi.
Likando.
Thank you very much. Sorry for joining in late. I was out in the field, so had to make a quick back from enjoying this. Okay, so in terms of us as Mary Stopes, I think we'll move on to the first slide. So who are we? We were established in 2008. So we are a leading provider of sexual reproductive health services in Zambia. We are committed to ensuring success and also to reach the undeserved population. So what services do we offer? We offer contraceptions, which are short and long-term and permanent methods, safe and post-abortion care. There's HIV and STI testing. And then also, we also do the treatment of cervical cancer screening and other health services that we provide. In terms of our partners, we do partner quite a lot. I think you can see from the list there. there's CHAI, there's also there's IPSA, and also different partners. I think I want to mention them all just to try and be quick with the slides because I don't want to take much of your time. Maybe we can move to the next slide to just a brief introduction about who we are. So in terms of our pillars, we do focus on 6 pillars of success. By 6 pillars of success, what we have is that with the first pillar, we've got leave no one behind. The other pillars, we've got also strengthen private sector provision. We've got client-powered sexual reproductive health. And then also, in terms of the pillars, what we're trying to do also is trying to have our missions funded, partnerships and advocacy, and transformational organizations. So in terms of the pillars, the 3 success pillars is what for sustainable service provision. And then the others do look at what to do to ensure that we have the funding, partnership, and organizational success necessary to deliver these goals to the population. I'll move on to the next slide. So I'll run through the 3 core pillars that we have. So in the first one, leave no one behind. This is to do with our outreach services. So our first strategy is also to increase access to the last mile through mobile outreach services. We target the rural, hard-to-reach communities. The second strategy for this first pillar also is to establish public sector partnerships, models to strengthen the public sector system and provide high-quality, sustainable sexual reproductive health services. The other strategy, the third strategy under Pillar 1, is for us to expand sexual reproductive health across to adolescents and persons with disability. What we aim to do as Stopes is that we operate in 9 rural outreach teams across the 8 provinces to mention that we are in the final stages of opening the last 2 provinces, which is Southern and Western Province. Southern was launched yesterday and Western will be launched tomorrow. So once we do that, we'll have all the 10 provinces and our outreach team can go and serve the outreach areas in those populations. Also, that each team will split into 2 separate sub-teams, which are going to comprise of 1 MSZ full-time provider and 2 public sector providers. So that's how the teams are being split in each province. And then in just to have a brief history, in 2023, we did provide services to over 350,000 clients, which was about 17.5% for adolescents and 6% those living in poverty. So since 2019, MSZ has supported health providers from over 250 public facilities with training and mentorship. The 2 pictures just portray what the team have been doing out there in terms of the outreach services. I think that picture speaks for itself. The outreach areas where even 4x4s get stuck, but we ensure that we reach these populations because they're in need of our services. Next slide. So in Pillar 2, we do focus on the services for sustainability. And these are the centers that we have. So we operate 2 centers that are fully owned by Stopes Zambia. These centers, we've got 1 in Osaka and 1 in Ndola. So the centers are designed to offer a full range of women's health services from menstruation to menopause, comprehensive sexual reproductive health services. We also include contraceptives and SAPAC services. So cervical cancer screening is also done, and treatment, STIs testing, treatment, and VCT are done also at our centers, including also male circumcision and other services that are coming, and also to do with postnatal, which is and under 5 services. We've also incorporated other general health services because we find that people come with different type of needs. We've seen that a lot in the Copper Belt, also with the new center we've opened in Masala. It's getting quite busy. So because people come with different needs, we try not to turn them away, but we try to offer as much services as possible. So for those who come for antenatal care, just need to mention this, we do provide this only up to a certain stage, because we do not go as far as the delivery of the child. So we do provide up to a certain stage, and then we refer them to other hospitals and clinics that can take over from there. So for the first, second trimesters, we're able to do that, especially in the first trimester. After that, we do send them to other health facilities through a referral type of process, so they can get better services from other gynecologists there. And just to mention that our center does offer different payment options. We've got both public and private sector insurance, which has helped clients also to be able to afford these services. I'll move on to Pillar 3, the next slide. So with Pillar 3, this is more of where I belong, social marketing, which is sales. With the social marketing, is that MSZ, we have this program called social marketing where we do distribute registered drugs to over 600 pharmacies across the country. And this was implemented for us to focus the distribution of high quality MA drugs. By MA drugs, we mean actually the medical abortion drugs, postmortem hemorrhage medicine. We also have the emergency contraceptives, and we have the oral contraceptives and pregnancy test kits. This is just the list of the services, that the type of drugs that we do offer to these pharmacies. So this is strictly separate from what MyStopes is known as it's a social marketing. So it's a self standing business on its own under social marketing. So we do sell these drugs to pharmacies and we sustain ourselves. We are not funded. This runs separately, but under the MyStopes umbrella. The type of products we offer, you can see that there's backup, Wellplan, MyPaste, MySoclear, and the pregnancy test kits, just to mention. But we're also looking to see what else we can do in the market in order to meet our customers' needs. So this social marketing department is backed by a team of 3 sales reps around the country who do manage the distribution countrywide. We also have a call center, which is a toll-free line, which helps to provide guidance to clients and customer care services to people who call in on use of our drugs, either before or after. I want to find out more about MyStopes. I want to do business with MyStopes. So that comes with the call center. I can move on to the next.
Yeah, Likando, if we can please summarize. I think we're out of time.
I think this should be my last slide, if I'm not mistaken. Or, yeah, the second last. Let me just say. So in terms of the clinical quality that we do, is that we do strive to provide clinical quality services to make it more safe and effective for all of our clinics and also everywhere we go in the outreach services. So what we do, if you look at the pillars which I've highlighted there, there's a training and capacity building that is done. There's clinical quality audits that we also do. There's also systems of maintaining good product quality from source to delivery, which is something that is monitored for us as commercial sales. Incidental management is also done through this, and then also continuous supportive supervision and mentorship for providers is also done, and the training that we also do to the public sector. I'll move on to the next slide. Oh, that was the end, actually. I hope I was fast enough, though.
Yeah, thank you so much, Likando. I think this was a great overview. So many sort of good lessons to learn, how, you are being sustainable there, the comprehensiveness of all the, services that you are providing. And I'm sure there'll be, a chance to discuss about that later on. Thank you so much. We'll now move on to Sheila from World Vasectomy Day. Welcome, Sheila.
Thank you. Thank you so much, Farhan. Good afternoon, good morning, everyone. First of all, Farhan and everyone who engaged us, thank you so much for this opportunity. I believe we'll be the only people who are going to be talking about male engagement in family planning and in sexual reproductive health and rights. And this is because we believe that family planning and SRHR should be a collective and coherent action for all groups who are involved. And this is policymakers, could be service providers, and most importantly, community members. Community members include men. And we believe that men are the last mile that we need to increase, most importantly, firstly, the general uptake of family planning options. And secondly, for us to use this education that we give to men to amplify the autonomy and agency that women need to make decisions when it comes to using family planning information and services. We are aware that for so long, men have had the autonomy and have been very influential in making decisions on family planning. And we hope at World Vasectomy Day, our aim is to get men more involved in these conversations, educate them, and they become aware of all these contraceptives so that women can have access to them. So World Vasectomy Day as an organization started 12 years ago. However, in Zambia, we started operating 3 years ago when we came in and did a needs assessment. I remember that year, I think they reported to us that 7 men had done vasectomies in Zambia, vis-a-vis about 6,000 to 7,000 tubal ligations. And obviously this number is very skewed because it shows that there are couples that are looking for a permanent method of contraceptive, but 7,000 decided to do a tubal ligation and only 7 went for vasectomy. And that could have been because of lack of awareness on what it is. Could be that there was lack of service provision on who could do the vasectomy. So our programs in Zambia include the Act of Love campaign. This is a campaign that we encourage all men to show different acts of love in family planning, in sexual and reproductive rights, and in community. And that could be just taking your partner to the clinic or to the hospital to get whatever contraceptive they are on. And for couples whose families are complete, for a man to do the vasectomy instead of the woman going to do the tubal ligation, and generally to give them information on both choices so that they can make an informed decision. We also do doctors training. This is both in the private sector and in the public sector. We worked with, remember in 2023, when we first came to Zambia, we trained 3 doctors from the private sector and 2 doctors from the public sector. This is in a way in order to strengthen systems both in the public and private sector. We have the Responsible Men's Club, which is a club of champions who have got vasectomies. You'll be seeing pictures in the following slides, but this is a group of men who came together and wanted to create a network and a movement for men who wanted to be more responsible, men who wanted to do more than just do family planning, and they're involved in things like planetary health. They're involved in paternal child care, which is not actually a thing because many of us know maternal child health, but we never think about paternal child health and what role men can play in raising their children. And through this, we also hold INSACAs. INSACAs are for groups of men. Those who have had vasectomy hold a different kind of INSACA, and those who haven't done vasectomies, whose families are still growing, but want to learn more about what contraceptives are out there and how they can support their partners. We also do young people programs, which include the basic courses for medical students on the theories of sexual reproductive health. We also do media workshops for young storytellers, and we teach young storytellers how to create messaging for health and how to tell stories on health. And then we also do the 24-hour Global Vasectomy Conference, where we talk to global leaders around the world and service providers, health promotion practitioners on what they are doing to have more men get engaged in family planning, get engaged in sexual reproductive health and rights. Next slide, please. So this is part of our Act of Love campaign. This is on the left side is a man who was just waiting to have his vasectomy. And on the right is a couple that work with us, and they are part of a group who we work with over years. And after 3 years, this gentleman got a vasectomy because he felt like his family was complete. This is his partner right there. His partner is now a champion, and also she holds groups of INSACARs for women, and to share with them stories on how their husbands and their partners can be more supportive at home. Next slide, please. This is a doctor's training. We worked with Mary Stopes to do this doctor's training in 2023. We can see some of the doctors here. Some of them are public sector doctors, some were private sector, and some were private sector doctors. These are the doctors that travel around the world who are great supporters of the work we do. They are first, they are donors, and second, they go on training missions around the world to just train all the doctors we work with in different countries on the no-scalpel vasectomy technique that we use at World Vasectomy Day. Next slide, please. So this is some of the activities of the Responsible Men's Club, which right now has about 150 men in Zambia, with many still wanting to join. This was on World Earth Day, April 22nd, where they went to the city center and cleaned up plastics in a way to show that they were aware of planetary health and they were aware of climate change, and they wanted to be part of the conversation. And on May 28th, World Menstrual Day, you can see a group of men who are giving out sanitary towels to underprivileged girls in school, because there's 34% of girls in Zambia miss school every month because they don't have access to, first of all, information and sanitary towels themselves. So these men came together and created this group and were able to give out, first educate fellow men on what it means to support their wives and their girl children. And then they also went out to different schools and gave out these sanitary towels as a way of support. Next slide, please. This is part of our Young People for Health programs, which I just talked about, which include teaching storytellers how to create stories for health. And that's our, right there in the middle is our CEO, Jonathan Stark, who is a 2-time Emmy Award winning film director who teaches all this. This is done in partnership with NIPA and the US Embassy, who give us this space for free to create these kinds of projects. Next slide, please. This is also another part of the media workshop that goes on with young filmmakers in Zambia. Next slide. So this is our first resource center in Zambia, actually in sub-Saharan Africa. And this is the space where men can come and have the education on all family planning options, including vasectomy and women's options. There's also training for young doctors who do the theory on what it means for men to be involved in sexual reproductive health and rights. However, we also have a urologist we work with who usually has talks on other sexual health issues outside of family planning for men. So could it be erectile dysfunction, infertility in men? Those are the conversations that men for so long want to have, but they've not had a safe space to have this conversation. So we have created this safe space so that men can actually come to this center and use it as a resource center to get information outside just family planning, but also sexual reproductive health and rights. Next slide, please. Okay, so this was just showing you what the uptake has been since WVD Zambia, where I mentioned earlier, we reported 7 vasectomies. That's what was given to us by the data in Zambia. 2023, last year when we did our first training, there were 196 vasectomies that were done. And this year, between January to July, yes, it has been 182 vasectomies. Today we have 198, which happened after I submitted our slide, and we are projecting about 350 by the end of the year. But I want to emphasize that for us at World Vasectomy Day, it's not just about the vasectomies, it's about men's health. It's about how men can support women. It's about how can men become part of this conversation. It's about men actually playing an active role and not a supportive role and standing in the back, but being the champions who hold spaces for women to be to create those spaces where women can actually make decisions on their lives and they can have autonomy on what they want to do with their bodies and with family planning and overall sexual reproductive health and rights, including sexual and gender-based violence. Next slide, please, Farhan.
Sheila,
Yeah,
if we can quickly summarize, please. Thank you.
Yeah, this is, I think this is my last slide, actually. Mostly this is where we are going with Dalividi Zambia is continuing to create a movement of men who are role models. This is very important to us. These role models can become influencers in their communities, and Dalividi can facilitate the different actions they take in their communities. We also want to work with private sector and public sector to strengthen health systems so that we have providers in the different regions of Zambia who can do a vasectomy or give information on male sexual and reproductive health and rights and male engagement. And definitely we want to work with universities and all allies to see how we can expand knowledge for male engagement in sexual reproductive health and rights. Thank you, Farhan. Last slide. Thank you
so much, Sheila. Thank you so much, Sheila. And it's such a great thing, as you mentioned, to see discussions on vasectomy. That's not something that we come across a lot in these sessions, and also hearing about all the innovative work that you are doing in terms of male engagement, which is so important, but not talked about as much generally in this particular space, or at least as much as it should, I feel. Moving on, we have Zanga Musakuzi from the Pharmaceutical Society of Zambia. Welcome, Zanga.
Thank you very much. Sorry, I'm in the field. I'm in Mumbwa doing an activity. Can I go on?
Yes, please.
Okay, my network will be breaking. So who are we as Pharmaceutical Society of Zambia? I think as a society, we fall into each and every presentation that has been made. We're a professional body of representative pharmacy personnel across Zambia. PSZ offers an independent voice in terms of pharmacy, providing adequate information to the public and also towards government in terms of usage of medication. Our key roles: advocacy in pharmaceutical practices, education and professional development, and promoting high standards in healthcare and pharmaceutical services. Next slide. Essential tools and resources for family planning and sexual and reproductive health, contraceptive guidelines and protocols. As pharmacy personnel were involved not only at national level, but also in private sectors and coming up with protocols that will help both government workers and also private personnel be able to have guidelines on how to use these tools. If we look at
Zanga, I think we lost you.
Yeah, I'm back. I'll try to persist because I'm really racing against network where I am. We look at training and capacity building. PSZ goes on to hold regular workshops for pharmacy personnel and even just the public, and educate them on different sexual reproductive health services which are there, and also patient education. Next slide. Family planning interventions that we've done, one of them that we did was with PPLZ. We had educated private pharmaceutical outlets to insert Cyana Press, which was good, and was still open with other organizations to come on board. If we talk about vasectomy, these are services that we can talk about in private sectors, especially in rural areas where we have so many community pharmacies. If we talk about community outreach programs, PSZ works with different national healthcare facilities, and NGOs to provide community-based family planning services, including education on contraceptive options and safe practices. Right now, I'm in Mumbwa as a farmers personnel educating people on how to use the hormonal IUD, and these are things that we as PSZ push that we can be part of. Next slide, please. Private sector engagement in family planning and sexual. Number one, private partnership. PSZ is open to work with different private sector so that we're able to push the agenda. Our target is to ensure to say the public out there, when we talk about medication, when we talk about the tools, it is as close as possible to the community, and that we as a association or society, we're open to partner, and we've partnered with USAID, we've partnered with PPSZ, and we're open to partnering with different people. Most of the time, we give an example of pharmacy being the goalkeeper, the last person on the pitch. We are able to provide information to the last client. Whenever patients go to the hospital, the last place they go to is the pharmacy. In community, people go to pharmacy. So we are open to private partnership. When we talk about innovative, one of our farmers personnel has developed an application called the Stopes Zambia app, and we're supporting him. And I sent a video, hope time will be there to share. And it is through this that we're able to educate the public on the importance of different reproductive health commodities that are available and how to use them. Next slide, please. Impact private sector on outcomes. I think we talk about increased access services. Private sector involvement has expanded access to family planning and sexual reproductive health, both in the rural area and urban area, meaning that when it comes to these services, we have moved away not only in the urban area, but also in the rural areas, and that is why we're targeting more pharmacists who are working in community pharmacies to engage with them so that such programs are open to them, improved availability of commodities. Farmers personnel, PSZ is part of the country when it comes to quantification, and we go on to push that more commodities come, and we're involved in this. Enhanced capacity building, training go on. Most of the time we try to train even the community-based people through different platforms. Next slide. This is my last way forward. We call upon partnership. Many people have presented. Pharmaceutical Society of Zambia, as farmers personnel, were open to partnership. Let's come together so that the commodities reach the last person in the community. And at the moment, our focus is the people in the rural areas that most of the time are left out when it comes to commodities and even information. Public advocacy for policies that support pharmacist-led SHR interventions. This is one where, again, we're pushing farmers personnel to be vocal because we're the ones most of the time who are issuing out or dispensing out medication. So we hope that policy advocacy can be looked at as farmers personnel. Capacity building, we hope to continue growing. As a society, we want to train as many farmers personnel, not only what we learn in school, but even when we start working, we want to achieve the universal health coverage goal, and this can only be achieved through capacity building. Thank you very much.
Thank you so much, Zanga. So the PSZ team has submitted a video that I'll keep, and maybe we can look at it during the discussions. One thing that I think is a takeaway from me from all these presentations that we've seen so far is that there seems to be a lot more of pharmacy engagement in Zambia. I definitely think it's a bit more than what we have seen in other countries, and I think later on in the discussion, if we have time, it would be great to find out, like why that is, because it's interesting. It's something that we've often discussed, and it's nice to see that there's a lot of pharmacy or community pharmacy and pharmacist engagement in these initiatives in Zambia. I will now pass it on to the Zenysis team, Kaluba and Aaron, who will, I believe they have prepared a video for their presentation that they are going to take us through. Welcome, Kaluba and Aaron.
right, please let me know if this works.
Good morning, good afternoon, and good evening. My names are Kalura Mataka, the Zambia Country Director with Zenysis Technologies based in Lusaka, Zambia. I will begin the presentation and my colleague will take the second half. To begin our presentation, who is Zenysis Technologies? Zenysis is a global health technology partner that leverages our open source technology as well as provides technical assistance to support data-driven decision-making, data visibility, and data use. We work with government funders, the NGO, the private sector across 4 continents to deliver better data solutions, as well as produce better health outcomes. Our team consists of both public health and technical experts. Working in the family planning space, we all understand the challenges of data fragmentation, or when information that is crucial to the decisions that we want to make are scattered in different formats, different data management systems, as well as being managed by different actors. This makes it especially challenging to analyze data in a holistic way. For example, we cannot really develop insights about the family planning market when key data around contraceptive volumes and pricing exists across both the public and the private sector, and social marketing data in different systems. Our digital solution harmonizes and integrates previously multiple fragmented and soiled data in near real time into a single platform to aid in data use, analytics, triangulation, visualization, as well as supporting data-driven decision-making. As I mentioned earlier, our technical experts in data use help users to understand and interpret their data, as well as define the decisions that they want to make. The diagram that you're seeing on your far left depicts the types of systems that might be fragmented, that need to be integrated. For example, it could be an Excel-based file, it could be an Access database or an SQL-based system. The image on the middle is where the magic of integration and harmonization happens across the different systems, regardless of their source format. And then the image that you're seeing on your right is where users are now able to pull the data from these different systems and create visuals and dashboards, as well as being able to triangulate and analyze the data. The platform and the dashboards and any other information products that users want to develop, as well as the technology, can serve as a tool to help generate insights about priority health markets, as well as serving as a market intelligence tool. In Zambia, our platform is called the ZamHealth Analytics Platform, or short for ZAP, which was originally developed to support the malaria program with their data priorities. Under the Frontier Health Markets project, as Zenysis, we led a 1-year proof of concept activity that sought to integrate private sector family planning data into ZAP to support stakeholders with the data that they need to make family planning related decisions. To do this, we consulted with the public and the private sector stakeholders to understand the key family planning priorities for market decision making, the data required to make those decisions, as well as negotiated data sharing agreements with many of them to be able to integrate this information into the platform to help enhance market data visibility as well as analytics. This project ran for a year and we developed a beta dashboard. And as a follow-on to this work, we are continuing this activity through a bilateral USAID mechanism. We're excited to be able to continue our work with the family planning market across Zambia, and to more closely analyze this data, support data use to ensure better family planning market intelligence and decision making. I will now pass on to my colleague who will share the demo.
Thank you so much, everyone. I am Mwamuli Aaron Mutinta, the Technical Advisor under Zenysis Technologies. I'll be demoing the ZamHealth Analytics platform and explaining how it can be used to explore market data, develop analysis, and generate insights. Like our other deployments, the platform integrates data from siloed systems. It has a user-friendly front-end interface that can allow any designated user be it a health markets expert or even yourself to create your own analysis and visuals. So with siloed systems, often they do have different naming conventions for products, locations to which the products are shipped to. Thus, for someone who would like to analyze this data holistically, it becomes a tedious process for them as they would manually need to combine this data, say in an Excel spreadsheet, and standardize the naming conventions. However, with ZAP, all this is automatically done in the back end via an algorithm, thus making it a very easy to use tool for the end user. So let us dive into ZAP and I'll walk you through the platform. So what you have projected in front of us is ZAP, and so you do have a number of features right here on top on the blue panel. We'll look at the analyze and dashboards for this session. So if you click on analyze, it basically takes you to this page that allows you to build your queries or visuals. So on the left-hand panel under add indicators, you basically see the different systems that you have integrated. So you do have data from one large private NGO, you do have data from public sector distributor, you also do have from commercial family planning distributors, in this case that's two, and also public sector non-health related data. So let's say you're a user who's interested in looking at the market share contribution by different players, and say you're interested in looking at how oral contraceptives are actually distributed through the private NGO versus the public sector. So this is how I would go about it. So firstly, I'll click on the private NGO data source, and then I'll select that indicator, which says private sector distributed quantity. I'll then go ahead and filter this just for the products that relate to oral contraceptives. So I'll select oral contraceptives and I'll apply. And then next, what I would select is go back to this add and add the public sector distributor data source, and I'll add that data indicator there. And so what we have is basically data from through those two channels. So what I can do is basically ZAP allows me also to filter to a specific date range. So I can say I just want data for the last calendar year. And then I can also disaggregate this data by month. And so basically what I have is all the data through the private sector distribution channel, which is at NGO, as well as the public sector. The platform also allows you to build various kinds of visuals. So you can have bar charts, you can have maps, you can also have trend lines. So in this case, you actually see the blue is for the private sector NGO, and then the green is through the public sector. And you see quite an increase in distribution between August and November through the private sector compared to the public sector. The platform also allows you to actually drill down to a specific entity. So for example, for the private sector, I can choose to say, I want to just look at data in terms of distribution for that private sector channel. So what we have here is a visual that's showing that where we've classified or broken down the private sector NGO distribution to the different entities. So we're able to see that most of the distribution is happening through the retail pharmacy for that period that we looked at, August to November. The platform also allows you to build various kinds of dashboards that you want. So for example, this dashboard that we have displays a snapshot of oral contraceptive commodities across select public and private sector data sources. The main objective of this dashboard could be to provide a snapshot of the total market situation among actors, including the private sector as well as the public sector. In this case, it's not a full market data for the private sector, but it actually does give us an idea of what's happening. So if I'm a market facilitator, I could use this type of dashboard for all the data that is important to know the specific decisions I would want to make. And also, if I'm interested, let's say in condoms, I can build a dashboard that's specific to condoms. So in summary, this is a tool that can be used to help enhance and align understanding of the total market situation, especially across public and private sector through data triangulation to identify market supply inefficiencies and gaps, and ultimately transform the way we make decisions. So with that, I'll end my demo here. Thank you so much for your attention.
Thank you so much, Team Zenysis, Kristen, Kaluba, Aaron. I think it was great to see all of the presentations and, see all the different facets of sexual and reproductive health and family planning that are taking place in the private sector market in Zambia. I have seen, questions have already started flowing in the chat, which is great. But before we jump into the discussions, I would like to invite Lois from the USA Zambia team to provide some remarks.
Thank you very much, and thank you very much to all the presenters. This is very enriching. Sometimes we sit back, we feel we don't have enough platforms to get our family planning data. And I'm happy that now we have Zenysis there that can demonstrate actually the good things that we do. It would be also very, I mean, I would look forward to seeing this private sector data being merged with the public sector data, because I think that's what we've been grappling with for a long time. So to begin my concluding remarks to these presentations, first and foremost, I want to thank all the presenters, like I already mentioned, also the FHM for bringing us all here together to learn from each other, to share lessons, to learn experiences and so on. And also everybody who managed to make time to participate. Thank you very much. I also want to particularly say thank you to Zenysis. I think they did a lot of background work, you know, reaching out to the speakers and coordinating them. So thank you very much for the job well done. Just maybe from the presentations we've seen this morning, I can see that obviously we are making good progress, you know, as far as growth of the local private sector in Zambia is concerned. So that's gratifying that everybody now is realizing the private sector is not an enemy, but essentially, you know, a resource or a fora where we can, for example, help to build the public sector by freeing up space and resources for those people that really need them. And for those people that can manage, the busy people that are hustling, obviously they don't have enough time to go and line up at a public facility. So the private sector actually offers them an opportunity to access the services that they would ordinarily, you know, get from the private sector, from the public sector. So it's gratifying that the private sector is coming up and really coming up with all these initiatives of how better they can reach the targeted audience. I see that our injectable contraceptives is still, you know, popular, and this is also, I think, being seen even in the private sector. So really, I'm hoping, and my dream is to see a lot more effort, you know, of donors, of implementing partners, bringing the private sector on board and helping to scale this famous product. Obviously, being cognizant of the compliance issues that apply so that we are not seen as supporting one method. Coming to the vasectomy presentation, thank you very much, Sheila. You know, I think most of the time men feel left out or they feel hopeless, like there's nothing they can do, you know. I know that some men are scared of, you know, they feel for their wives going through, you know, the pregnancy, going through labor, and so on and so forth. But obviously they don't seem to have any option or know what they can do to help. But I think initiatives such as yours is a good one, gives the men also the option to participate in the reproductive health life. And lastly, maybe just 2 points I want to mention here. We still have, I think, issues with the regulatory authorities. Efforts are being done to engage them. You know, they need to come on board so that they make the environment, you know, conducive for providing services in the private sector. And we also need, I think, investments in SPC. We still have, I think, a bigger chunk of our population still in rural, still holding on to their values, their customs, which is a good thing. But, you know, there are some misconceptions, myths that need to be dispelled in order for them to access the services that can be life-saving. So with those few remarks, again, I just want to thank you, everybody, for participating, the presenters for this very educative presentations we've had today, and hopefully we will see more things coming. Thank you so much. Bye-bye.
Thank you so much, Lois, for those remarks. Yes, and now we can go into discussion. We have around 13 to 15 minutes to do that. Just going through the chat, there are some resources that have been shared by Anne. There is another question from a set of questions from Anne for Dr. Lucy, but I believe since Anne is not here and has provided her email, that can be done offline. I do see a question for the Pharmaceutical Society of Zambia from Kuyosh. And so, Zanga, I don't know if you are able to hear us based on your connectivity issues, but there is a question that talks about, them wanting to learn more about your member organizations, or rather your members, and what is the experience, for instance, with accessing affordable financing capital to build up the business for the pharmacies and improve their operations.
Okay, I've gotten the question, although it was breaking. Can I just reply in the group? But if you're able to repeat the question again for me.
Zanga, just to summarize, it's, I guess, what is the experience in your pharmacy network in terms of like access to capital, financing, in order to sort of grow your pharmacy businesses among the pharmacists?
All right, thank you very much. Great question. To start with, access to capital, most of them are private individuals who are just starting up pharmacies. And we also have a cooperative where people are able to access some funds and start up a pharmacy wherever they want. At the moment, we're trying to encourage our members to open up along the rail and also in rural areas, because that is where we know we've got less government health facilities there. We might only have one hospital or one clinic, but if you have a pharmacy there, that has got a wider range of commodities to provide. So access to capital, it is 50-50. Members are encouraged. Many are getting through the cooperative. I hope I've answered your question. And is the market okay? Yes, the market is very, very fertile for private pharmacies, and we are in support of them. When it comes to regulations, yet again, as a society, we try to assist each and every individual to align to the different regulations that are there until they start up and they go on to run their pharmacy. I submit.
Okay. Thank you so much, Zanga, and I'm sure there can be much more conversation on this, but thank you for those initial thoughts. And definitely the role of an association like the Pharmaceutical Society of Zambia is very big when it comes to, being that bridge between the regulatory authorities and the actual pharmacists and providing that kind of support. So thank you for what you are doing, and I'm sure there will be people in the group who are interested to learn more and connect with your team. I do see that the Zenysis team has been responding to the questions that they have been asked on the chat. So thank you for that. Sheila, I saw you come off mute for a second. Did you want to say something? Because I do see a comment here for the the Act of Love campaign, and there is a question there in terms of like, what role do you see private facility providers having in Zambia to increase access and uptake of vasectomy, given that it is so costly? Yeah, if you can respond to that, please.
Thank you so much. I think I just went off mute by mistake, but I'm happy to answer Rebecca's question about the role that the private facility providers play. It's true that the cost of vasectomy is so costly, and usually even when couples want to do it, they will usually opt for the tubal ligation because it's just a bit more less costly for them as a people. So what we are trying to do right now is to work with doctors in the private sector, first of all, to train them in a less costly technique. If you see in most of the countries in Africa, for doctors who are doing the vasectomies, they're doing the scalpel technique, which takes longer, which is less effective. And yet for us at Dalividi, we are using the technique with the electrocautery, which is looks like a pen, and it can be reused for over 100 or 200 other vasectomies to be done. So if you find that the actual cost of the vasectomy, all you need to buy is the disposables like the 30 gauge injection and the lidocaine, which is just for a little bit of pain. But the thing with the forceps are reusable. So you find that we are trying to teach and to train doctors in the private sector with this new technique and supplying these supplies to them, these medical supplies that they need in terms of the forceps and the electrocautery. But when it comes to other things that are disposable, are pretty much cheap on the market, like cotton and the lidocaine. With the lidocaine, I think the 7 ml, they can do 30 vasectomies on that small bottle. So the big thing is for us to train doctors in the private sector in the no scalpel vasectomy, which we are already doing because it's just more sustainable and cost effective. Thank you.
Okay. Thank you for that, Sheila. So there are 2 questions that have been left by Devendra that are, open questions. I would say if we can even hear just one of the panelists answer each, and then of course, hopefully the discussion can go on beyond the session as well. So one is, how are you leveraging digital tools or platforms to improve access to family planning services, especially for youth? And what business advantages do these innovations bring to service delivery points? Without putting anyone on the spot, I don't know if perhaps maybe Likando wants to, talk about this, because I think there were some elements of youth engagement and using digital aspects in his presentation, if I remember correctly. And then I think related to that, in what ways are you integrating client feedback into your strategies for engaging the private health sector? Likando, are these questions that align with your presentation?
So maybe because I was doing something, could you repeat the question? Just want to be more clear. Yeah.
Likando, 2 questions. One is, how are you using digital tools, if at all, to improve access of family planning services for youths? And what advantage do you see these digital tools bringing? And then is there any way that you are incorporating client feedback into your strategies? And, how do you do that?
Okay. So maybe I'll start with the digital. So how we are doing in terms of Stopes with the digital platforms for us to incorporate the youth. We've got, like I said, with the call center, which is a toll-free line, but also what we've done is that there's a lot of work on social media. That's our social media pages on Facebook and Instagram. There's a lot of traffic coming on Facebook to do with our Diva Center. So the Diva Center does accommodate for the adolescents quite a lot and the youth on these matters of sexual reproductive health. We've got a Diva Center here, which is so isolated from the rest of us here at the office, and there's a lot of privacy. It's got its own entrance for the adolescents and the youth that they do not have to mingle with us as they come. They've got that privacy where they can walk here independently on their own. Most of them are found us through the social media platforms, the active pages that we're using, the campaigns that we're also using, and the call centers, but mostly with the social media platform. So we've seen quite a lot of adolescents and youth engaging about sexual reproductive health and also other problems that they've been facing either at home or at school or in their relationships, and most of them are quite young. So they've been coming through to learn more about what we do. Also, us going also with the caravans that we do. We've got a mobile caravan that's goes to densely populated areas where we station, and our target mostly are the youth. We go there to educate them about safe sex, the use of condoms, also contraceptives, and also look at those who've got other problems, like maybe they are pregnant, they were raped, and they need that counseling to be done. So in terms of the digital platform that we've been using, mostly the TikToks and the Facebooks, and they've really, really helped us to capture this audience that may not be willing to share with their parents what they're going through, but they've got this Diva Center where they can come and talk about what their problems are. And because it's so private to them, tailored to them, that it's an office with its own entrance and they don't need to meet any of us who are like older than them, it has received quite a lot of feedback, even from our Facebook pages. So that's in terms of digital. Then with the client feedback, so with us, we deal quite a lot with the pharmacies. And also in terms of engagement with public and private sector, we have seen quite a lot of feedback coming from pharmacies on what we are doing as Stopes, what we can do better, and also the services we can offer them. In line with our strategies, we do know there are some who would openly tell us what the need for the population is in that particular region. If it's Western Province, if it's Eastern Province, where my team is, there's always that feedback on what we can do better in terms of services we can provide and also drugs we can provide on the market. This does help us in that it helps us to strategize. If it's in our means to provide it, we can. If it's not, I think our team have done very well with trying to engage with other players on the market to share these opportunities with them so that at the end, the client is satisfied and happy that they got the service that they wanted. It may not be directly from Stopes because we may not have what they're looking for. Like there were a lot of people asking for injectable contraceptives in the market, in the pharmacies, and we know that people who do provide that. So we're able to give them feedback on how they can get those services. May not be from us, but from other players in the market. And I think that has works quite well, and vice versa. I think we've also been recommended with in the market by quite a number of players. So I hope that answers any of the questions.
Thank you so much, Likandra. I definitely think it does. So in the interest of time, I think we'll have to end here. I see another question from Musa in terms of like, how the private sector interventions have been tailored to address the specific challenges and opportunities within the country and what lessons can be learned. I think, Musa, this would be a great conversation for you to have with Dr. Lucy and the ZamHealth project, so please feel free to get in touch with them. And for, thank you to the Zenysis team for responding to your chats, and generally to all of our presenters today and to the participants for giving us a very engaging time of discussions. Before we quickly close, Kuyosh, I don't see Ben here again, so I don't know if there's anything that you want to say just as an ending remark.
I would like to thank you first for the amazing facilitation, and as always, we're lucky to have you co-lead this session with Ben and Andrea, and looking forward to the next sessions. And thank you all the presenters for allowing us to learn about the reproductive health market in Zambia. You are doing an amazing job, and we're looking forward to staying in touch. Please join future sessions and continue contributing and also learning about FP markets in other countries. And thank you everyone who joined today for your excellent questions. And I'm sure Farhan and team will follow up and offer some answers to some of the questions as well. Great session. Thank you, Farhan and FHM, for also organizing and all the work that went into preparing today's session as well. Thank you, everyone.
Okay. Thank you, Kuyosh. And yes, thank you, Zenysis team as well for helping us in co-organizing this particular session. Next slide, Elizabeth, quickly. So we just want to inform you all, and there were some questions around Sierra Leone that will be answered hopefully in the next session. So our next session is going to be on September 25th at 2 p.m. GMT, and this one will focus on Sierra Leone as a country. In 2024, we are looking in October 2024, we are looking forward to focusing on Malawi, and then we'll hopefully close off the year for these HMCoP sessions with a thematic session focusing on pharmacy and drug shops, which we know is a topic of interest. So yeah, thank you so much, everyone. Be sure to visit our page. You know, we have our website here. As mentioned, we'll share the recording with all the participants. And if there are any questions, any feedback, please feel to use the email addresses on the screen right now to reach out to us. We will see you at the next session. Thank you so much.
Thank you.
Thank you.
Thank you, everybody.
Thank you, everybody.